This is Dr. Yui Sakseo, a plastic surgery specialist in Area 88. There are areas patients feel a bit lacking after facelift surgery. There are several reasons for this. One is of course, the difference in surgical method. I've mentioned there are many types of facelift surgeries in the last video. There are many variations when deciding which case should pair with what surgery. In particular, the method of dissecting and fixing the smas and skin is very important. For related videos, please refer to the links in the description box below. Having had the same surgery, some patients are very satisfied versus others who express they feel something's lacking. One reason for this is skin. For all surgeries, adhesion takes place in the operated layer during the recovery process over 8 to 12 weeks. Just as it takes time for wallpaper to be applied with paste, dried and stuck to the wall, so is this process necessary for facelift. Facelift, especially for dual plane, lifts the skin and the smas separately over a wide area, and there isn't some adhesive to stick everything together, so until things fully adhere, skin will sag slightly from gravity. After liposuction of the belly or thigh, compression garments are worn for 24 hours to ensure uniform adhesion. Compression garments can be worn for the belly and thighs, and hidden with clothing. There are various bands that can be worn on the face, but there isn't a way to compress the whole face including the mid-cheeks effectively. Also, people can't wear them around constantly. This is one of the reasons I don't actively perform facial liposuction. To solve these problems, I had used high-frequency waves, I2PL, light and lifting treatment, LED light, and electric stimulation equipments like the Cardio Vital, but had doubts about its effectiveness. But all things considered, studies have shown high-frequency waves are effective for swelling and fine lines, and indeed they work. This is because they circulate the lymph nodes and heat the dermis. Therefore, high-frequency waves are used after various procedures and surgeries. However, these waves must be transmitted effectively to the surgical site, but regular high-frequency equipment isn't able to penetrate to the deep layer. Among high-frequency waves, there's a device called TOR, and it's got a lot of advantages. Among high-frequency equipments, TOR can reach areas that are deep onto the face. It can be thought of as ironing in order to keep things uniform and avoid sagging during the adhesion process after surgery. The most prominent high-frequency equipment include Thermage, InMode, and TrueSculpt. I've used and compared all three of these devices. First, Thermage delivers high-frequency waves by piercing the dermis with a needle. This isn't compatible with post-surgery goals, so I'll exclude it. InMode and TrueSculpt are equipments designed to eliminate fat. In fact, InMode removes fat by flash transmitting a high-voltage current to high-frequency waves added with pressure. The waves themselves do not eliminate fat. TrueSculpt is a device that claims to remove fat with high-frequency waves alone, but whether this works as claimed is questionable. This is related research provided by Cutera, maker of TrueSculpt. Most research are self-conducted by the company and rarely credible. Here, change in the amount of fat has been measured by ultrasound. This is an ultrasound picture showing 29% of fat has been reduced in 12 weeks with one treatment. It seems to have been measured by just pressing. Here too is an ultrasound picture showing a 26% reduction in one treatment. It seems to show the zoomed in and downscaled photos, and it seems to have been reduced. Not reliable at all. This is a video I took of the belly fat using superfine ultrasound. The amount of fat changes like this depending on how hard you press. This is pressed hard, then press lightly. This is an ultrasound photo showing a thickness of 6.4 mm. The left is the zoomed in 6.4 mm and the right is the same area zoomed out. The same area has been taken simply zoomed in and out. To measure the size of tumors, structures, and the ultrasound is accurate, but to compare the amount of tissue such as fat it isn't appropriate. That's why you can't believe this American company Cutera that made TrueSculpt. This is a research regarding InMode. The same is true here. It's a complete mystery as to which part was taken in the ultrasound on left. Histological findings such as the one on right are helpful, but the gap between histological improvements and the way patients actually feel is big, so if a proper doctor is doing clinical trials, histological changes should only be reference, not a deciding factor to proceed or not with treatment. These types of ultrasound comparisons and papers, and them being used to sell and advertise equipment, deceive both doctors and patients. Though there still remain those who believe university hospitals, professors, and published papers are credible, times are different now. Such for show papers and sloppy studies are condemned. Also, not only is the price the equipment over 100 million South Korean won, but also the user has to recharge through the company every time they use. As in, X number of shots are charged, used, and recharged through additional payment. This makes the treatment expensive, making it a downside. On top of that, it's not as if one can really achieve the amazing result of 26% to 29% reduction in fat in one treatment as advertised by the company. In any case, equipments like InMode or TrueSculpt wasn't made for the purpose of post-surgery care or ironing like for myself, but for the purpose of removing fat. Both devices can be used like TOR by switching hand pieces, but they're a bit chunky to work with fine details of the face. In the case of InMode, they're pretty much like regular high-frequency waves and cannot reach deep layers. If you try them, you wouldn't see much difference from a regular low-cost high-frequency wave. TrueSculpt is similar to TOR, but it doesn't carry as many different handpieces. TOR has 3 handpieces of different sizes. So you can treat very intricate areas such as around the eyes. Among high-frequency devices, one that can reach deep layers and is well suited to serve the purpose of ironing is TOR. I've used high-frequency devices before, but patients can already feel the difference. It does not remove fat yet delivers high-frequency waves to the deep layers. It's a very good device for post-surgery care after dual-plane facelift. It supports the process of adhesion after surgery very well, increasing patient satisfaction and further improving the outcome of surgery. It's obviously good to receive treatments like TOR often. It's like if you iron your shirt every day, it will look fresh and clean. Patients use the expression that their face feels neat and clean. However, there are realistic issues like cost and having to come to the hospital, as adhesions take about 8 to 12 weeks to complete after facelift surgery. In my experience, it seems appropriate to receive TOR treatment around 4 to 5 times at 1-week intervals starting from 2 weeks after surgery. It's been proven high-frequency devices improve fine lines and swelling through lymphatic circulation, so it is no surprise TOR has high satisfaction rates. Previously, post-surgery, standard high-frequency treatment, high I2PL's lifting mode, Cardio Vital, LED light, etc. were used and they were better than not doing anything, but didn't seem to have a big impact on the outcome of surgery. TOR, unlike its counterparts, has improved parts that could not be solved by surgery alone on a higher level, so I feel I've found a very good device I'm satisfied with on this aspect. In any case, from the patient's point of view, it is fundamental that doctors explain things accurately and perform the operation well, and they can only be sensitive about post-surgery care and recovery period. Therefore, a doctor must look for reasonable ways for a better, stable result. Attracting patients through ways like inaccurate information, advertisement-based videos, and low prices similar to false used car sales, then raising prices, should be avoided as doctors. Patients no longer believe in them either. Thank you.